You know how the word depression gets thrown around for everything from having a bad day to a really serious medical condition? It can get super confusing, right? Well, today we're going to clear all that up. We're going to break down the key differences between just feeling sad, what clinicians call major depressive disorder, and something called persistent depressive disorder.
And this quote just hits the nail on the head. The word is living a double life, and that creates this fog of misunderstanding for a lot of people. Our goal with this explainer is to slice right through that fog and give you a really clear map of what's what.
So here's our game plan. First, we'll separate the everyday word from the clinical conditions. Then, you'll meet the two main players, MDD and PDD. After that, we'll use a really powerful analogy, the drop versus the plateau, to make the difference stick. We'll look at why this all matters for treatment, get some perspective from older frameworks, and wrap up with some clear red flags for when it's time to get help.
All right, first things first, let's tackle the most fundamental piece of the puzzle, understanding that we're dealing with one word that's doing two completely different jobs.
So on one hand, we all say, I'm depressed in a casual way. You know, you feel down, you're sad, maybe you had a major setback. It sucks, but it's temporary. But when a doctor or a therapist talks about depressive disorders, they mean something way more specific. We're talking about actual, diagnosable syndromes that have rules, a certain time frame, a specific group of symptoms, and, this is the big one, it has to be getting in the way of your ability to actually live your daily life.
Okay, so inside that clinical world, there are two big conditions that people often mix up. So let's properly introduce them. Major depressive disorder, or MDD, and persistent depressive disorder, PDD.
First up, MDD. The keyword here is episode. To get this diagnosis, you have to have a distinct period of at least 2 weeks where you're either feeling incredibly down or you've lost all interest or pleasure in things you used to love. On top of that, you've got other physical and mental symptoms, like your sleep is all over the place, your appetite changes, or you feel completely drained of energy.
And then there's PDD, which you might have heard called dysthymia. Now, the keyword for PDD isn't episode, it's chronic. This is a long-haul, low-grade depression that sticks around for at least 2 years in adults. The symptoms might not be as intensely severe as MDD, but they are relentless. We're talking about that constant low energy, feeling bad about yourself, and this sort of nagging hopelessness that just doesn't go away.
So how can you really wrap your head around the difference between these two? Well, this is where this idea of the drop versus the plateau comes in. And honestly, it's a brilliant way to see it clearly. And this is so important. To really get MDD and PDD, you've got to look past just a simple checklist of symptoms. The most critical clue, the thing that tells you what you're dealing with, is the pattern of the illness over time.
And this visualizes that pattern perfectly. MDD often feels like a sudden, steep drop from how you normally feel and function. It's a huge, noticeable change. PDD, on the other hand, is like a chronic, low plateau. It's this persistent state of just less energy, less hope. It can go on for so long that it starts to feel like the normal emotional background music to your whole life.
Let's just put them side by side. For MDD, the pattern is episodic. It hits you acutely. For PDD, it's long-standing, it's persistent. The duration, we're talking at least 2 weeks for MDD versus a minimum of 2 years for PDD. And while MDD can be more severe in the moment, it's the sheer grinding endurance of PDD that wears you down. The core feeling in MDD is often a total loss of pleasure, while in PDD, it's more of a chronic hopelessness.
Now, and this is a really important thing to know, these two aren't mutually exclusive. You can actually have both. A person who's been living on that low plateau of PDD can suddenly take a steep drop into a major depressive episode. It's a brutal experience, and some clinicians even call it double depression. So why are we making such a big deal about this distinction? Because it's not just academic. Figuring out the right pattern is the absolute first step to getting the right kind of help. Let's see why this matters so much.
Well, the risks are totally different. With MDD, the dangers are often immediate and severe. We're talking a high short-term risk of your whole life grinding to a halt, and critically, a higher risk of suicidal behavior. With PDD, the damage is cumulative. It's a slow burn that builds up over years, strained relationships, not being able to achieve what you want to, and this gradual hardening of a negative identity where you start to think, I guess this is just who I am.
And because the problems are different, the treatments need to be different. For an acute MDD episode, therapy is often like firefighting. It's focused on immediate symptom relief, getting you moving again, and just getting you through the crisis. But for chronic PDD, the therapy has to go deeper.
It's got to target those deeply rooted interpersonal habits and those long-held beliefs about yourself that have been building up for years and years. In fact, this distinction is so crucial that entirely new therapies have been invented. A perfect example is something called CBASP. It's a type of psychotherapy that was designed specifically for chronic depression, to help people untangle those exact persistent, knotty patterns that define PDD.
Now, this clinical map we've been using is essential, but it's not the only map out there. For thousands of years, other traditions have had their own ways of thinking about these states of being. So let's just zoom out for a second and see what they have to say.
What these systems basically ask is, hey, can we understand these states not just as a disorder, but in terms of fundamental human energies and quality?
Take Ayurveda, the ancient system from India. It looks at qualities. A feeling of dejection might be called Vishada. That chronic, heavy, sluggish feeling of PDD, it lines up really well with what they call a Kapha-Tamas profile, basically a state dominated by heaviness and inertia. And then more severe states that look like MDD could be seen as a much deeper imbalance.
Yogic philosophy has a similar way of looking at it through what they call the gunas, or the basic qualities of nature. The chronic inertia of PDD, it's a perfect description of tamas, which is this quality of dullness and low energy. And MDD, which can often feel like being exhausted and agitated at the same time, that could be seen as a messy clash between tamas, that inertia, and rajas, which is a fiery, restless energy.
Okay, let's bring it all back home to the most important, practical question of all. With everything we've talked about, how do you actually know when it's time to stop wondering and go get professional help? Here are the big red flags. If a low mood has been hanging around for more than 2 weeks and it's making it hard to live your life. If you are having any thoughts of suicide, and please, you must get immediate help if you are. If you literally can't handle your basic day-to-day responsibilities, and listen really closely to this last one, if you have started to believe that this chronic low mood is just part of your personality. This right here is probably the single biggest red flag for PDD, and it's the #1 reason people don't get help. It's when you normalize your own suffering. When that low plateau feels so familiar for so long that you just accept it as a personality trait, you are confusing a treatable condition with who you are. This is not just you.
And that really leaves us with one final powerful question to think about for yourself. Because chronic depression can start to feel so ordinary, it's really worth asking, is the normal that you've gotten used to actually a plateau? And is it possible that, with the right help, that plateau could be higher?